Okay, week two, we've done our quiz. Just to let you know, there is no quiz next week. It is on your syllabus, but next week is Martin Luther King. So Monday's classes, which there's six of them, five of them, they don't get the quiz, so no other pediatric class gets the quiz. What we're going to do is give you it on exam week, which is week four, and it will be on week three's information. So I think what I'm going to do is do it after the exam so that you're seeing the information. Or do you want it before? You tell me what you would like to do for that exam, for that
Quiz
quiz.
before.
Quiz before. Okay, anybody else?
Yeah, I would like to
Every
do it before too.
Okay.
The exam might stress us out too much, and it'd be better to just do the quiz first.
No, it's it's any time during that week that class. So if that's what you want, I will work with that. I totally understand it. So okay, so we'll do the quiz before the exam. And again, it's on week three's material, which is school age adolescents. All right. So that will be that quiz. It's the only change that I have on the syllabus. In fact, it's a new quiz and everything that I had to develop. But this was a request from one of my other professors. Hey, let's just do it on week four instead of pushing back the quizzes and then have one on week nine where you're supposed to be nothing. So again, I think it's a great idea just to say no, 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 no quizzes. So today, what we're going to do is we're going to do our PowerPoint. When we get through with the chapter 31 on infants, we're going to do a cahoots. And I think there's 20 some odd questions on that. Now, infants is the hardest of all the head part on growth development. So it is a longer part of the chapter, part of the lecture, and it has its own cahoots. Toddlers, preschoolers are extremely similar. Therefore, I put them together and I think through the cahoots, I'm showing you the very slight little differences in them. Okay, so it worked last term. The students loved it. So let's go ahead and let's start with the PowerPoint. These PowerPoints know that I always put them in your announcements, and I think you've already got this week announcement. I think I put it on for this tonight tonight at midnight instead of tomorrow. So it's all right. You got your information. That's all that matters. So let's go ahead and let's start. So infants, I'm telling you, this is the most remarkable thing that I know in any part of medicine is what happens to a baby at birth in the first year of life. We know that they come out of the wound, they don't even know how to take a breath. Then we stick things in their mouth. They learn to suck and breathe. And then they put milk in their mouth, whether it's through a breast or through a bottle. And now they're sucking, swallowing, and breathing. By about 2 to 3 months, they're starting to do that reflex palmar grasp. And now, at 2 to 3 months, their head is starting to lift up. They get in that hand control, which means there's no head lag. Head lag is when you pick them up and their head falls back. We know by 3 months, absolutely, that head should be coming up when we pull them up. Now, one of the things that we measure very closely on infants is their weight. Your first discussion question was all about nutrition and yourself, of course. And I just got done finishing them up on your class. Make sure you go back and look at the comments I put there. There's some very good comments. I put every single discussion question. I don't say good job or you didn't do this. No, I'm going to give you some more information. Actually, some information you'll see on quizzes, exams, and essays. So it behooves you to look what I put there for you. I think this week has one that makes you think. How do we look at stuff and how do we figure things out? Yes, Lavana, may I help you?
The link inside of the announcement that you sent us, I don't think it's working because I'm not able to pull it up.
I was just about to
Okay,
say the same thing.
I will also put it in the recording announcement. I put it two places in the information and the recording. I will do it again. And again, anybody who sends me something like that, hey, I can't open it. I'll send it through a Canvas message, and usually that will work. So one person lets me know, everybody gets it. So again, if that happens, please just let me know, and I can take care of that. Okay, so we talked about nutrition and we talked about the importance of it. We know that if we don't fill the tank with gas, your car doesn't run. You don't feed an infant properly with the proper vitamins and minerals and iron and stuff, they're not going to grow physically, but mentally, cognitively, they're not going to be where they should be. And that's through the way that they move. That's their hand movement. That's their head movement. That's all central nervous system connected movements. And even just a little cooing and speech, we look at those things. So when we're looking at a child and we're looking on overall growth and development, one of the things is that the weight, right? So an infant at birth is full of fluid. They've been, flowing around in mommy's, amniotic fluid, right? So they're full of all this extra water. At birth, they're going to be losing up to about 10% of their body weight. Absolutely normal. Now, in the newborn ICU, in the ICUs, we're always measuring everything, how much they're drinking, how much they're urinating. And when parents get these kids home, they're going to say, but I don't know if they're eating enough. They're on the breast now. We used to measure it. Well, all we need to say, as long as they're getting 6 to 8 wet diapers every day, we know that they're drinking enough. Also, we usually have these infants in after 2 weeks out of the hospital, right? That's because we're going to make sure now they should be up, almost catching up to their birth weight, because they're gaining 5 to 7 ounces per week now, okay? And that's a lot of weight for a tiny little 7-pound baby, okay? We also, as we're weighing them, making sure now that they're gaining weight properly, at 6 months, they should have a double of the weight. And if they're not, we need to find out why. Are we not feeding them enough, or are we feeding them too much? Underweight, overweight, okay? So that weight really telling us. And we're going to be looking at growth development. If they're not meeting milestones, we're going to be looking at the nutrition and the weight. Are they getting enough gas in the tank to feed the brain? At 1 year, they should about triple it. Do you realize they have 1 inch per month for 6 months? The first 6 months, they gain in heights. That's a lot of height, 6 inches in 6 months. So you can imagine how much nutrition these kids need in order to keep up with that, right? And we know they get pudgy and they get longer. They get pudgy, they get longer. And that's that growth spurt that you do see. And you do see it really a lot in children where they get pudgier and then all of a sudden you see them getting taller and slimmer looking. Now, as we get older, we get that maturation of the body systems. And what does that mean? Well, at birth, the first 28 days of life, that baby's called a neonate. After that, up to 1 year, they are an infant, because you're going to hear those two names, neonate and infant. And what's the difference? Well, the neonate are your tiny ones, neonatal ICU, brand new infants. It's the way you remember that, okay? So as a neonate, heart rate, what is normal? 140 to 160 at rest. It could be 200 if they're screaming, okay? Normal. That's not an elevated heart rate. Now, for a 1-year-old, it's elevated. Is it pain? Is it volume depletion? Or is it a fever? Because why is the heart rate going to be elevated? Those are the 3 possibilities, right? The respiratory rate at birth, neonatal, 40 to 60. And by the time we get up to 1 year old, it's probably 20 to 30. And that's normal, at rest. So why do we need to know the numbers? Well, how are you going to evaluate? Are they volume depleted? Do they have a fever? Are we giving medicines that can decrease a heart rate like digoxin? Are we sure that we're giving it a proper dose, and is that heart rate normal for the child? I did send you that vital sign sheet the first week. Now, it's a guide. It's not the numbers. Don't know numbers. Just know that they decrease the heart rate and the respiratory rate as they get older. And blood pressure goes higher. And that's what it does. And if you don't know, you look it up. But just to be aware that there are differences. Now, at birth, mommy gives everything to that baby, right? Their immune system, the blood, the hemoglobin, hematocrit, and it's wonderful because babies do not start making their own blood cells to somewhere about 5, 6 months, somewhere in there. You don't have to know the dates, but know that at birth, baby does not make its own blood cells, and blood cells by themselves die off, right? So mommy's blood cell, the hemoglobin, hematocrit, is going away slowly. And what does hemoglobin and hematocrit carry? Oxygen and iron. So the iron levels are getting lower. So hematocrit is getting lower. They actually can be born with a normal, perfect 14 hemoglobin. And by 6 months old, their hemoglobin can be 10. Absolutely normal. And as long as they're not symptomatic, we don't treat it. As long as they're getting the proper iron in their diet, right? Because iron, hemoglobin, they're connected there. So it's normal to see those things on those children. As I said, the head growth, we're going to equal that chest right around 1 to 2 years. That was that question I just discussed with you. Another thing is those fontanelles. Now, the one in the back of the head, the posterior fontanelle, that closes really quick. Like within 2 months, it's gone. And it's really small at birth. You really can barely see it. You have to know about it to go looking for it. The one on the top of the head, the anterior fontanelle, that usually will not close to between 1 year, 1.5 years old. Now, why do we need to know those things? Well, if I have a posterior fontanelle that's still open at 6 months, that's a problem. Why is it still open? What's happening? Is there something going on in the brain? Is there swelling in the brain? Is it hydrocephalus? Is a brain tumor? What's happening? So again, we'll be looking for why it has not closed or why did it close too early, like the anterior fontanelle, because we need that head to get bigger. We need it to grow with them. And if that fontanelle is closed, it's not going to happen. And the other thing I like about this anterior fontanelle, you can see so much fluid balance in a child with that little fontanelle is so easy to look at. If it's flat, we're good. If it's sunken, you're dehydrated. If it's bulging, maybe it's hydrocephalus. So this little thing right there, that little soft spot, is a big thing to look at when you're doing assessing. Another thing about infants when they're born, they don't see well, right? So we put black and white stuff up. We found that's all they need. But know that one eye and the other eye, they don't work together. This eye sees and this eye sees. It's called binocularity, which means that when they go to reach, you need two eyes to figure out that point where you're going to. With just one eye, your depth perception is off. It's about in the toddlers that it starts to get better and depth perception gets better. Now, we've mentioned hemoglobin, we mentioned mom giving immune system. So mommy gives them, what they can. We know that maternal antibodies are given also through breast milk. We know that feeding a baby breast milk is the best thing for them, but not every parent, never every mommy can do it. So at least iron fortified formula for the first 6 months of life, okay? Now, babies are born with this cheese on them, I call. Is that vernix? It's just an immune thing. It's just a protection of it. Know that mommy gives a lot of stuff, but know that babies can get immunizations. And right about 2 months old is when the body can accept it and make the antibodies inside so they can protect themselves from whatever disease we're trying to protect them from. Now, another thing at birth, babies do not regulate their own body temperature. They're born, they've been underwater and they've been warm. Okay, so they have a lot of extracellular fluid going on and they can't keep it warm. At birth, what do we do to every infant? We dry them off, put a hat on their head, and put them underneath some sort of heat, a warmer, a crib, whatever it is, but it's heat. They're going to put them under because they do not have their own regulation of their temperature yet. As they get older, all of that extra fat goes off, all the extra fluid goes off, and slowly as they get older, they are tolerating and can regulate their temperature better. But a newborn, neonate, needs an extra protection of covering because they cannot keep themselves warm. Now, Some of the things that we do mention and we monitor with growth development is motor development. Now, there's two types of motor, so you have to be careful when you're reading questions. There's fine motor, F, fingers. What do I do with my hands? And it's all about grasping, putting things into a container or out, and building a block by 1 year old, okay? So, prehension is called grasping. Initially, what happens? Well, initially, mommy puts the hand inside the little warmer, and that baby, by a reflex, grasps the hand. And the mommy goes, "Oh my goodness, my baby just gave me a hug. Isn't that awesome?" Don't you dare tell them that was a reflex. Let that mother enjoy the moment when that baby gave them a hug to their finger, okay? Don't ruin it, all right? Eventually, they start even grasping by themselves later on, 3, 4 months. And now they're doing a voluntary grasp. Usually they get a hold of a rattle or something that you've given them and they put it in their hand, right? About 7 months, they can take it and change hands now from one hand to the other hand. Then we have a pincer grasp. This is usually what 6 months. We put them in a high chair, right? Making sure that we prop them up because they don't sit unsupported yet. That's 8 months. But at 6 months, we put them in there because now we can feed them and we got that nice little high chair. We want to use it, right? Then we put those little puff things on top because they go in the mouth and they melt. So, what does an infant do at this age, that young age, 6 to 7 months? They take their hands. The pincer grasp is usually the thumb and forefinger, very like that. It's a fine pincer grasp. Initially, they take and sort of smoosh it in their face, whether it's those things, and they get it in, but eventually end up with a fine one. At 11 months, they can take things out of containers, those little blocks that we put in those nice containers, and then we take the blocks and we should be able to build two, one on top of each other. Doesn't mean you can do 4 or 5, doesn't mean you could put it in and out. I mean, you could do more, but this is the minimum that they can do, okay? And there's a test for you. Now, the other sort of movement, physical things, motor control, is gross motor. Gross motor is get up and go, 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 as Paw Patrol would say, okay? Which means movement, which is muscles. Head, muscle, controls head movement. So the first thing they do is control their head. And I said that's 2, 3 months when they're going to have better control of it. I mean, they're bobbleheads at birth. We have to really protect their necks, right? At 5 months, they should be go from their abdomen to their back and 6 months back to abdomen. Sometimes they skip it, go to 6 months and rolling completely over. And again, as long as they're rolling 5, 6 months, we're doing okay. Sitting unsupported, 8 months. Biggest Hesse question, biggest NCLEX question right there. Sitting unsupported, 8 months old. That's when they should be able to do that. They should be able to go prone from their backs and should be able to sit up by 10 months. And we know by 12 months, we're going to be walking or attempting to walk. Now, some kids walk at 9 months, some kids walk at 15, 16 months. They're both normal as long as they're meeting the other milestones as we keep going, okay? So locomotion, cephalocaudal. What does that mean? We lift our head up first, or cephalic, our head, right? And then we walk. That's the feet. Gross motor, first year, that's what it is. We're going to be crawling, and every kid crawls too, but we should be crawling about 6 to 7 months. Some kids skip crawling and go right to creeping, which is standing up, walking on the side of a couch or a coffee table or somewhere. They want to stand up and they want to creep around. That's my grandson, my newest one. He's 8 months old, 8.5 months old. He don't want to crawl. He wants to stand up and creep. That's just him. Again, everything is moving in the right direction. Walking with assistance is about 11 months. That's what all parents do. Hold them, trying to make the kid walk. They're going to walk when they want to walk. And about 1 year, they should be walking alone. My kids never, ever walked at 1 year old. They attempted to. I tried to say, oh, maybe they did take a step, but it wasn't. I know my daughter at 15 months, my babysitter, I called home to see how they were doing. They go, oh, yeah, she's starting to walk. I says, oh, how many steps did she take? 76. And I said, that's not walking, that's running. So my kids never walked, they ran. And it was my son, it was my daughter, it was my grandsons. That's just what they did. So again, as long as developmentally they're going right. So nutrition, nutrition, nutrition. You need to know how to feed these babies. First 6 months of life, it's breast milk or it is iron fortified formula. And breastfed babies need to have a vitamin D supplementation. Has to do with muscle growth, et cetera, et cetera. They recommended milk, whether it's formula or breast milk, the first year of life. After 1 year, they're encouraged to put them on whole milk, not part skim, none of that. They need the fat for their central nervous system to at least age 2. It helps with nutrition of the brain, okay? Again, babies, they should eat 8 to 10 minutes on each breast. We know that 6 to 8 wet diapers. We know we're getting enough. We know that the weight that they've lost, they should be gained by 2 weeks. That's why they go to the doctors again, and this is the weight gain, etc. But again, first 6 months of life, it's just milk. Now, why don't we feed them more than that? Well, the only time that we would give them any sort of food is when you have a baby with reflux and they keep spitting up all their milk. And we put a little rice cereal, whether it's breast milk, we'll give them a little rice cereal before they breastfeed, or we put it in the bottle of a bottle fed baby. And it's 1 teaspoon per ounce. And it thickens it up just enough to try to hold the milk down. Now, the rice cereal doesn't really get used and absorbed because the GI system does not know how to use it, but it's keeping the milk down. So they're getting more nutrition in the long run, okay? Another thing, the stool. You're going to see everything they eat in their stool initially. And this is actually after we start feeding these children. Just think about you today. You eat corn. Aren't you going to find corn in your stool in the next day or two? Absolutely. Your body still has a problem with it. So this is what these infants go through. But you're going to see carrots and corn and green beans and all sorts of different stuff. And it's absolutely normal. Now, the second 6 months, we start to feed them. They say rice cereal is the best way to start. It's the least allergenic. So we start there and then we start putting on fruits, vegetables. What order do we do? Depends on your pediatrician. But the thing is, one food at a time, and you don't change it. You leave that food for 4 to 7 days. And what you do is you look for food sensitivities. Now, what would an infant show you if they didn't, let's say they're eating carrots and they don't like it and the body's reacting to it? You might see this is severe dermatitis, this baby here, that's almost like an eczema, psoriasis sort of thing. But again, it could be food allergies that's going on there. Another thing you might see is a diaper rash. That was one thing I used to see, on my children. When they didn't like something, you would see a diaper rash or vomiting, diarrhea. Food intolerances you'll be able to see. So when we give one at a time, we know which food they're allergic to. So we get away from that. And then we give all the other foods, and we might, again, try it again to make sure that that's the allergy. And then, of course, allergy testing and whatever they have to do, or just avoidance of that food. So foods usually in the first try don't give anaphylaxis, but I know probably one of the highest allergy things is nuts of some sort. I actually had one child who brushed somebody's hand going in outside and he itched his nose, and apparently that guy had peanuts. And this kid blew up. It went almost anaphylactic. And the mother already gave him an EpiPen, running him into the ER. Peanuts are a big thing. My grandson is the walnuts, the pistachio, the tree nuts. He blows up and goes, he starts like that. So again, he carries an EpiPen. Now sleep. Babies sleep a lot. They eat, they drink, they, burp, they, go to the bathroom and they sleep, 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 sleep. Absolutely normal. Breastfed babies actually wake up more frequently. Usually it's breastfed is every 2 hours. It's just because it's more of a clear liquid versus the formula. Dental health. They say a tooth initially, the first one is about 6 months. Now, doesn't mean everybody gets a tooth at 6 months. Again, I'll go back to my kids. They didn't get a tooth. At 1 year old or 15 months, they had six. It was like all of a sudden they popped up. Again, normal, normal, normal. Once they come up, you need to toothbrush with water, no toothpaste, but we can give some fluoride to these children, okay, to keep their tooth good. Some of the things that we can protect their teeth: no bottle propping, no milk in the bed, no juice in the bed. That just keeps sugar on their teeth, which will rot their teeth. Tell you, my first son had bottle mouth because he used to carry the bottle in his mouth. It was before sippy cups. And he would carry the thing and he would just walk around and apple juice in it. Who did I know, right? I should have, but the teeth did rot with it. So no milk, no fruit. And then there's that controversial, some people like it, some don't, but pacifiers. Pacifiers have gone through use them, don't use them, they're good, they're bad in the 40 years that I've known children, okay? Now, the thing that they say now is pacifiers are good. Their child, the infant, explores the world in its mouth. And the way they can self soothe, that's why it's called a soother also, is with their mouth. Put the pacifier in, they suck on it, and they feel happy. Also, a pacifier with some sugar water can actually be used for anesthesia. It could be used for circumcisions. It does work. So, if your kid is 12 months old, the possibility of how many teeth that they could have is six, because it's 6 months is six. So it's 6 months after that. So it is six teeth that they could possibly have. Now, immunizations. Did you see that big list in your book? It's a double-page thing all about immunizations and when do you know, when do you give them, et cetera, et cetera. Well, I'll let you know that you need to know hepatitis B is given at birth. All right. Measles, mumps, rubella. That's about 1 year old. Remember, varicella is a live vaccine. And remember the restrictions on live vaccines. You can't be immunosuppressed. You can't be on steroids. It's another way that you are immunosuppressed, okay? That's a med-surg question there. And know that infants at 6 months old can start taking the flu shot, the influenza shot. Children get a colic, usually happens at birth to about 4 months old, and then it resolves. These are difficult children. They're hard to work with. They cry a lot. You're always in a car driving them somewhere. You lose a lot of sleep with them. That's the dysomias and the parasomias. You sleep too much, you sleep too little, etc. And then sometimes we have a child that at 6 months, he should weigh 14 pounds, only weighs 9 pounds. That is what we call failure to thrive. And along with that, at 6 months, they're probably not rolling over. They're probably not lifting their head up because they haven't gotten the nutrition to put gas in their tank to have the cognitive ability to be able to do those things. So again, failure to thrive is when they're not getting the nutrition. One of the things that happens in especially your ill children, premature children that go into the newborn ICU at birth, and we can't move them for some reasons. And something happens to their heads. Now, their scalps are so soft and malleable and pliable. Just think they just come through the birth canal. So they had to squeeze and get through there, right? So it is soft. You can see that. If you leave them on one side of their head and you can't move them due to their physical condition, you're going to have a flat head. Now, how do you help that parent get that head round again? Well, many times it's just putting them on tummy time. When they're well awake, well alert, put them on their tummy time. This helps them move, it helps them stretch, helps them explore. That's that object permanence time. They're looking for that rattle they want, right? And that little bit of time, a couple times a day, will help round it out. Now, if it's resistant, they do have those helmets. I've seen them in kids in the grocery store all the time, right? And what it does is just trying to make their heads round again. Another thing, and I've mentioned it briefly, is diaper rash, diaper dermatitis. I think this is a curse for parents and children at nighttime because you get them all lathered and creamed up and bathed and smelling pretty, and you get them to bed, they're sleeping, and they urinate and they wake up because they've burnt that diaper rash. So trying to prevent that's important. When we get diaper rash, there's a lot of things you got to look for. Is it food? Different type of diapers, different lotion, different cologne, different bath soap, different laundry detergent, all of those things you've got to look at, okay? Because that could make a difference. My kids did not like Huggies. They liked Pampers, and that is actually with my last grandson. Same thing. So again, knowing your child and preventing it is going to give you better sleep. Another thing that happens at birth is cradle cap or a seborrheic dermatitis. It's just white, flaky stuff, dry skin thing. So how do you treat it? Yeah, you still wash it with baby shampoo, gentle soap and water, but then you put some mineral oil on it or moisturizer and get it moist. And then you just take a little fine tooth comb, gently comb it. And it's not going to happen in one day that it's fixed. It's going to take a while, but slowly you'll get rid of all those flakes. Now, sudden infant death syndrome. This is SIDS death. This is something that's been looked at. I know I went to work at my pediatric hospital in the early 90s, and it was something that was studied way back then and is still studied today. And what they found is there's an increase of SIDS death for children that are not breastfed, okay? Also, children that were placed on their sides or their bellies to go to sleep. So they recommend all children for naps and to sleep to be placed on their back to sleep. That's usually the name of the program, back to sleep. Now, SIDS death, what are the risk factors? Males are more than females. I've got 5 grandsons. I've always been freaking out about the males and SIDS death and getting them through that first year, right? I watch when I babysit my grandson who's now 8 months. I watch him breathing because I'm afraid of SIDS death. It's that first year. And yes, he's on his back. I'm doing all the right things. Another thing is cigarette smoke in the house. Getting them too hot. You remember, as they get older, they don't need as much clothing. They don't have to be with the hats and the socks and the everything. You have to know your baby not to overheat them. Don't put them in the bed with you. I've seen quite a few of those where the husband or the mother rolled over, was on the infant, didn't know it. Yes, they didn't know it. They were larger people and they didn't feel it, and babies got to us and they had died. The other thing is, what if they just had a little upper respiratory infection, got mucus in the nose? Again, suck, swallow, breathe. Infant is a big deal, right? Put a little mucus in their nose and now increase of SIDS death. Remembering immunizations. That means they're getting sick when they didn't have to be sick. And then, of course, it's the socioeconomic sort of things. And they do recommend breastfeeding for SIDS death has decreased, and back to sleep has decreased how many SIDS deaths have occurred. When we have an infant, and I actually see quite a few of these when I was working in emergency room, young infants in the first couple months of life, where they take a breath, they hold it, and they turn blue, and the parents bring the kids in. Oh my God, he stopped breathing, he held his breath, he turned blue. I didn't know what to do. Well, we call these an ALTI, or an apparent life-threatening event. Was it a reflux? Was it a seizure? That's what we have to rule out. And that would be the medical treatment. They're admitted. That's it. They're admitted. Young kid, ALTI, you're admitted. You're getting an EEG, you're looking at the brain, and you're doing a reflex study, seeing what's happening. And you're going to be sent home with one of these apnea monitors. Has anybody ever had an apnea monitor or heard it? It is ear. It's like so loud, and it goes right through you, the sound, and it will wake up the infant and will wake up the parent to go run in to take care of that infant. And it's easy. It's a Velcro strap. That's it. And the leads are already there. Easy to use. Now, safety and infection control will always be on every exam, every NCLEX, HESI. That's just part of it. Whether it's med surg, adults, children, is part of it. So safety promotion starts out all children. Remember, every type of children, all ages, this motor vehicle. That's where all of the accidents, the most injuries are motor vehicle. Also know that part of that injury protection, prevention of children is us nurses teaching, making sure children today, they're doing a lot more. I've noticed with pregnant women, getting them in for infant CPR, infant massage, and whatever else you need today, you can be very well prepared, if you have the time to do it, right? And the means to get to these programs. And the other thing, very important with children, is water safety. Teaching your children how to keep away from the pool, or teaching them how to swim. By 2 years old, my last grandson, who just turned 9 last week, at 2 years old, he could do front and back flips into the pool and swim, no swimmies on at all. His head would just be there and he'd be swimming, and he knew how to keep himself safe. And he also knew you better not even think of going near that pool unless an adult is with you. And again, I've seen too many drownings, and it scares me again. So Letitia is a breastfed infant being seen in her clinic for her 6-month checkup. Her mother tells the nurse that Letitia recently began to suck her thumb. Which of the following is the best intervention? Is it normal for a 6-month-old to suck her thumb? Is C. Reassure that thumb sucking is normal at that age. My daughter liked her index finger like this until she was 4 or 5. She would always have this finger in her mouth. So, theorist, I want you to know that on the exam, there's a lot of theorist questions. So I'm going to try to describe these in a manner that you can remember them, all right? So Erickson talks about the child and the people around him. How does a child respond? How does he call out? Or how do they interact? Child with another person is psychosocial. Social means the other people. So an infant at birth, what do they know? They know how to cry, don't they? So when they cry, why do they cry? They're calling out to somebody, hey, I need changed. Hey, I'm hungry. Or, hey, I want you. I hear you out there. I'm awake. Come on, let's play, right? When you go and you pick up the baby and do your little things and change him and whatnot, you're talking to him. Oh, that baby's a happy, healthy, well-adjusted little infant. Now, there is times where that baby is not picked up. And I'm not talking 1 or 2 times. Consistently, most of the time, they are not picked up. The child cries and cries and cries, and nobody comes. They end up stop crying, because they realize I'm crying, but nobody's coming. So why am I going to cry now? Because no one's there. And that is mistrust. This happens in environments. It could be, some sort of homelessness situation, could be drugs, alcohol abuse, could any of those things could cause mistrust. Okay. And as a nurse, you'll be able to see it where this baby just lays there, doesn't even cry no matter what you do. It's not normal. Okay. And that's usually, make me think, is this baby safe? Because as a nurse in children, one of your biggest jobs is protecting the child. If you suspect anything, you need to talk about it. You need to get that child protected. We know children do all things, they grasp, they bite and whatnot, and it's just part of their exploration of life. Now, cognitive development, thinking. How do I think? I've learned to suck, swallow, and breathe. Now, we're going to be going into Piaget. Piaget is all about how do you understand and how did you learn that? So we put spanked a butt. I took a breath and I continued to breathe. I put something in their mouth and I started to suck. And now I'm sucking and breathing. It just happened. And then I put milk in that, whatever, and I'm sucking, swallowing, and breathing. Oh, look at that. That is part of, let's say now we had that reflex grasp, and I got now a rattle in my hand. And I moved it and it made a nice noise. Next time I get that rattle, I'm going to shake it again because I've learned that sensory or motor, it's all about touch, mouth, and movement. That's your first up to 2 years of life. Figuring out what things touch, what they taste, where they move like. This is figuring things out. So now that rattle, I now shake it and, I like the noise and I'm going to do it next time. But then all of a sudden it fell in my mouth. And I went, ooh, nom, nom, nom. I like that too. So next time they get the rattle, they're going to shake it and they're going to put it in their mouth. So you build it up by schemas, right? Little things make you understand and you build upon those and you be able to be more and more sophisticated, complicated with things that you're able to do. Okay? That's infants. So sensory or motor, as I said, is that first up to 2 years old. As we get older, I'll go into that next, but then it's just taking those toys and now we're going to be playing because now we say, oh, this block now is a car and this is another car. We're going to roll them around and play with, because that's magical thinking as we get a little bit older. Now, body image. At birth, babies don't know what they are. Then all of a sudden, they're having their feet in the air and hands in the air, and they're trying to suck on their toes and everything. And this is all about figuring who they are. Putting babies with a mirror in front of them is a lot of fun because they try to touch it and beat up themselves in the mirror, right? They don't know what's happening there. And we know the world is explored through their mouth. Everything goes in their mouth. Sensory or motor, right? Ori is that oral part of it. And then that object permanence, which means once they see something, they know it's there. And next time they're going to go back and they're going to look for it. As I said last week, you could have a 1-year-old put the toys away at the end of the night. First thing in the morning, even though the toy's put away and it's not in sight, they know to go look for it, right? Well, infants, that's why they go start searching on their tummy time, looking for their rattle or looking for their whatever. Social development. Now, attachment. We know that babies like their mom, their dad, their grandma, whatever, they're very attached there. We know it. Separation anxiety. That's a couple different stages that we have. We have the stage where, mom and dad many times have other children, full-time jobs. They cannot stay if a child is admitted in a hospital many times, okay? Or they might have to leave for a little while and come back. And that's just reality. And as nurses, we need to understand it's going to happen. Older infant and a toddler are going to have a hard time with that. So Separation anxiety at first. Mommy leaves, baby knows, child knows, mommy, daddy are gone, and they scream and cry like crazy. Then they realize they're not coming back and they regress. An infant might, put their pacifier in or a finger in their mouth or that rattle, trying to soothe themselves because they're really upset. And then the third stage of separation anxiety is when mommy and daddy come back and that child doesn't want anything to do with them because they don't want to be hurt again. They already went through the crying and the regression. They don't want to do it again. And then stranger fear, stranger danger, right? Infants at first, they don't want to come to you and they hide in mommy's shoulder or daddy's shoulder, right? And all of a sudden, about 6 months, they start looking at you from behind. So now you start playing that peekaboo. Now, again, start playing games, and children respond to games, right? And we're going to see children as they're getting older, they're cooing and they're making noises. And by one, they should be saying one-word sentences: mommy, daddy, milk, juice, cookie, whatever it is, right? And we know social development is all about play, play, play. Infants, what play are they in? They just watch and play by themselves, don't they? All right, let's do our first cahoots. Who wants to win? Nobody wants to win today?
Miss Bogart?
Yes.
I'm still on my phone for this. Are you able to send the link in the chat box so I can type it on my computer to get into the Kahoot? Or is it in the announcement or something, the link?
Okay, what you can do is I'm going to put this up and take your camera on your phone
Mm-hmm.
and you take and you hit this little code here. Do you see that little
Code.
UPC code? Right next to the number, that little thing, put it on your phone and it will pop right up to it.
Code. I don't know how to use those without pulling my camera out.
Or you go to
Hold on.
kahoot.it and you just put in the
I'm
code
just gonna do that.
54210. Whatever works.
Thank you. Okay.
And again, students taught me this.
Yeah, I'm right there with you on having to learn from other people about this stuff.
Absolutely. All right. Are we ready? Again, guys, I don't go back and look at these results. You're not looked down at, up at, nothing. This is your thing to help you remember, okay? So don't feel like but I'm not getting anything right, and then I don't look at it, okay? Infants. In general, an infant should triple their birth weight at what months of age? So they triple it and it's going to be at 12 months old. Again, why do we need to know that? If they are not gaining weight, we need to find out why and evaluate it. It could be the problem why they're not talking, they're not walking, they're not whatevering, okay? Something that we look at very closely. An infant weight should blank by 6 months, sorry. And we should double it by then. Multi. Infant nutrition includes. Now, I don't say everything in lecture. I can't. There's just so much. So this is one part of the nutrition. So we should not give honey to an infant until they're about 2 years old. With the sterilization and whatnot, the baby, they shouldn't get it. There's things that can happen for that. And we'll go into that more as we keep going. And also, They should have iron fortified formula to 1 year old or breast milk. At 1, we can put them on cow's milk, whole milk. They need the fat. Do we avoid finger foods? No, but you just got to make sure they're proper. And we should be giving one food at a time every 4 to 7 days, not every other day. A multi. Infant nutrition for the first 6 months. So, first 6 months of life, only human breast milk or iron fortified formula. Now, iron fortified could be soy, could be many different things, but it's formula that's iron fortified. That's what it means. It doesn't have to have DHA, doesn't have lactose free. It could be all different types. A multi. Nutrition interventions for an infant include I think we've hit this little subject, this concept in a couple different ways, but this is the final one. Remember, breastfed babies should be getting vitamin D. Iron, no matter whatever formula it is, must be iron fortified. And we always, one food at a time, every 4 to 7 days, and then we can introduce another food. And we do that, and you'll see some books say 5 months, but we say 6 months, okay? 6 months we should do it. But 5 is not really wrong, all right? An 8-month-old infant should be expected to perform which fine motor skills? So this question, motor skills, fine, it's about fingers. F is fingers. That students get really confused with questions. Gross motor, fine motor, and how do I answer them? Well, I'm telling you how. F is fingers. An 8-month-old should be able to grab that rattle and then that crude pincer, that Cheerios, those little puffers in the mouth, okay? Before they get to that little fine little one at a time. I like it when a little infant takes one at a time and puts it in their mouth. I think it's so cute. Which of the following is an example of fine motor skills in an infant? So fine motor skills is fingers. Everything else is gross motor, get up and go, 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 isn't it? So it is only grasping it with the thumb and 4 fingers. Again, look at the question. That's how you won't get it wrong. Which is the correct order for development of gross motor skills in infants? Gross motor, get up and go, 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 Paw Patrol. We know the first thing they're going to do is their head. Head control, that's the first gross motor. We got to figure out how to keep that head up. Then we roll over, we crawl, we creep. Then we're walking, attempting to walk by 1-year-old. Gross motor skills, get up and go, go, go. At what age can an infant typically sit unsupported? And then when I say, at this age, so if at 1-year-old they can't sit up, what's the problem? Well, something's wrong. What are we going to do? We'll evaluate nutrition, but we're probably going to start early intervention. This is the reason why we do all of this growth and development and trying to figure out, is the child on track? Because if they're not, we're going to start early intervention. Speech, physical, occupational therapy. I mean, most of you have heard about the kid who doesn't talk a lot, and at 2, we start speech therapy, right? Well, what if a kid was 6 months old and his head was lagging back and still not pulling up? we're going to start physical occupational therapy, aren't we? And the sooner we start it, what's the beauty about children? They catch up really quick. So the earlier that we start it, the quicker they catch up. At what age does an infant typically start rolling over? And that's about 5 months old. 5 months from their abdomen to their back, and then 6 months back to abdomen. An infant's head circumference is so at birth, an infant's head is big. And then all of a sudden, everything else catches up by 1 to 2 years old. The chest is bigger. How do you apply nystatin to an infant with thrush? Again, you had this one last week also. And again, it's just showing you differences in care on medications and infants versus adults. I mean, nystatin is a swish and swallow, right? Or swish and spit, whatever the doctor wants. But an infant can't do that. So it is that cotton swab to the area, and that's what we would do. Blank is contraindicated for treating fever in children. So we will not give aspirin to children for any reason, for a fever, for pain, or anything. There's one disease in week 5 that you'll hear about, Kawasaki, because we want to thin the blood. Okay, but if we give aspirin to some children, that could create Ray's disease. It's a metabolic thing, and they get very sick. So first 6 months of life, only acetaminophen. At 6 months, we can start ibuprofen. Now, why isn't ibuprofen used earlier? I've asked that question. Something to do with coagulopathies and the platelets and ibuprofen. So we don't do that to young children. So 6 months for ibuprofen. What is the primary goal in treating a fever? Like, why would you take your Tylenol for your fever? Why? Think about a child who's sick with a fever. What do they look like? They're sitting in the corner, sucking their finger, not eating, not drinking, and they're whining because they feel miserable, right? It's to relieve the discomfort. Have you ever seen a child? They're sick in the corner, not feeling well. You medicate them for fever with a proper dose. In about 30 minutes, this kid is running around and acting like they were never sick. But the big thing is now they'll drink. Because remember, fevers, they need extra fluids, and dehydration in children is the most dangerous thing. Dehydration can completely shut down all the body systems of a child. So let's reduce that discomfort and getting them drinking, which is what we want. I don't care if they eat, I want them fluids. Infant's Erickson stage. Erickson, a way that an infant responds to social beings, the people around them. What is an infant? What do they know about the people? And they know if I cry, somebody's going to get me. That's trust and mistrust. We'll go into the other ones. Those are all Ericksons there. And I'm going to try to explain why they are there. Which pain scale is used to assess an infant? Now, I think only one person got the flack and faces question wrong on the quiz today, which is very good. Infants, they don't know how to tell you what's going on. They can't point to a face. You've got to look at what they look like. As in a child sitting there not moving, afraid to move after surgery. Oh my God, that hit kids hurts. Or that legs are moving because the stomach is full of pain and gas and These are things that we would do. Faces, legs, activity, crying, consolability. A multi. What is the best time to assess an infant? So kids being admitted or kids in the urgent care ER and you need to do a quick assessment on them. When's the best time to do it? As in, when can you really do a good assessment? And if they're asleep, this is the absolute best time to listen to heart sounds and lung sounds. Think about an infant when they're awake. They and you touch them and it's very difficult to listen to those sounds. And we know infants feel safe, comfortable, happy when they're in mommy's arms. Where should you place a car seat for an infant under the age of 1? You'll always see car seat questions. So it's in the back seat, facing backwards, and there's now staying in the middle of the car. Most of us put it behind the passenger, right? So as we're driving, we could see them. They say it should be directly in the middle of the back seat, okay? But make sure that the shoulder straps are on snugly. You can take blanket rolls and roll around the smaller children to hold them in place. In fact, I like to put it underneath because I like it softer on their butts. Which of these does tummy time help with? What's tummy time for? So we know tummy time gets them on their tummy, makes them move, uses all their muscles, and it's good if they have that head that's all, flattened on one side. We want to straighten it out. Has nothing to do with reflux. Good. Which newborn can have an ABO incompatibility? Do you remember that from maternity? And what happens to infants who have an ABO compatibility? They get physiologic jaundice, right? They have hyperbilirubinemia. So it's when the blood types are different. It's O positive, A baby. That means there's difference between them and their blood is incompatible. So you're going to have a lot of explosions of cells and you're going to have that bilirubin that's dispersed. So which intervention may decrease the incidence of physiologic jaundice in the healthy newborn? So a baby's born and you know there's ABO compatibility. What can you do to help keep that level from going to the point of needing like a double exchange transfusion? Okay, so when you pull the blood out and put new blood in at the same time. It's a very scary procedure. So we get rid of our bilirubin through our GI tract, okay? The sooner we feed them, the sooner they're going to start stooling. The more stools we get out of them, the bilirubin's going to go away. So early, frequent feedings, get them to start stooling, and that will keep the bilirubin lower. And then if not, we put the eye patches on, and they go underneath a light. An infant is NPO due to their medical condition. What's important to remember? Proper growth and development. This infant can't eat. What do we know about infants, neonates? So what we're going to do is we're going to give them a pacifier because it calms themselves down, right? It gives them what they need. It needs that comfort. Multi. A mother of a child is suspected of having Munchausen syndrome. What should be in the care plan? I didn't go over Munchausen syndrome, but Munchausen syndrome is when a parent, caregiver likes to keep a child sick or gets the kid sick. Or I've seen things like using toilet water, injecting it into IVs. I've seen wounds that they keep putting stool and dirt and things in to try to keep it infected. So this child is at risk for that caregiver who's been watching them, right? Now, it's hard to pin it down, but it's a child who's constantly chronically admitted into a hospital. So these children, until we know better, we need to protect our child, like I said earlier, right? So when the mother comes in or that caregiver that you think is causing it, you have somebody, one of the staff members, whether it's a secretary sits in that room or a care assistant, somebody in the room protecting the child. Also, anything that comes in that room, you need to look at it because it could be in the food they bring in or snacks or milk or anything. You don't need somebody with them all the time. No, only when that person suspected is there and you need to monitor it. Yes, the mother can still come in unless you have proof that that's the mother's doing that and you got a court order. A multi. Frequent developmental assessments are important for which of the following reasons? Why do we look at them turning over and their weights and, where they're grasping? Why do we need to know that stuff? So we do these assessments because we can institute early intervention if we see those delays that are going on. And that's the purpose of it. Because as I said, the earlier that we institute it, the quicker these kids turn around. Moros. It's a reflex, startle reflex. What is that? And these are your young infants. Moral reflex, startle reflex is when you hit the crib and it startles the child and they put their hands and their feet up. Their hands, it's like they splay. Or they make a loud noise, you slam a door and their hands and their feet come up. It's normal for an infant to do that. We want to see that. A multi. What are risk factors for SIDS? What can cause SIDS? Breastfeeding actually decreases the incidence of SIDS, but males smoke and that viral illness because it's clogged noses. Infants, children, infants, small kids are obligatory nose breathers. So put mucus in there, they can't breathe good. The rooting reflex, what's that? I call them look at that little Rudy Tooter. Rudy Tooter. You stroke their little cheek like that. And what do? They go, oh, there's that bottle and there's that breast, and they start to eat. This is what we do for usually the first time feeding them. Let's give them that reflex and we'll put something in there that they can eat or drink. All right, let's see how we did on our first cahoots today. We got M&M, or it's just MM. Karina, good job, Karina. Number 1. An AG. And we have a Maya and a Kai. So good job, guys. All right. So now what we're going to do is we're going to finish with our PowerPoint. And then we're going to go off into our next Kahoot. So let's do that. So toddlers. Now, toddlers are ages 1 to 3. I think when we think of toddlers, we think of those terrible twos, don't we? I love this saying by Jerry Seinfeld. I have had this here for years and I just can't take it off because I think it's so appropriate. Toddlers is like having a 2-year-old with a blender without a lid. You turn it on. They're everywhere, one place at one time. They're very difficult. They're intense exploration going on. They're trying to figure out the world, okay? So this is the age of temper tantrums. How do you treat these temper tantrums? You ignore them unless it's going to hurt themselves or others. So we had huge growth in that infants, right? Well, now everything slows way down. As I said, you do not quadruple your birth weight till about age 2.5. Amazing, huh? That's another 1.5 years it takes to go again. Again, it's slow and steady. Body systems are maturing, heart rate's going down, blood pressure's coming up. We know that this is the age of multiple upper respiratory ear infections. It's chronic, constant. And the reason is they explore the world in their mouths and they're swapping spit and germs all day long, aren't they? Okay. We know this is the age where they start to potty train, right? Temperatures are okay. They're becoming more refined. They're starting to throw balls. They're using both hands. Their vision is getting better. There's more depth perception here. And the one thing that happens with their senses, their smell and taste and their touch become extremely refined and developed. And they become the most pickiest eaters at this point. You know, as infants, it didn't matter what we put in that baby's mouth. They eat everything, don't they? Have you ever tasted some of those formulas or those cereals? They're nasty. For me, it's like, ugh, it tastes like cardboard. Infants think it's amazing. Well, toddlers smarten up and they start to only like certain foods, right? This is the time where toddlers are at risk for anemia because of lack of proper nutrition. I say a toddler, give them chicken nuggets, macaroni cheese, and apple juice. Everything's golden, but you know, they need the fruits and they need those vegetables. So let's talk about the theorists. Let's talk about Erickson. Let's talk about that explorer, that toddler, okay? So what are toddlers? Automatically, everything's me, mine. Autonomy. Mine. I do. No. Don't help me. I want to do it, you know, and just that what they want. Okay. Negative. That's, you know, the way they want to do. Now, what is the shame and doubt that's involved with this Erickson? Well, what do parents and grown-ups do around toddlers that are exploring the world and getting into things that can hurt themselves? They stop them. Or they're getting dressed and they're not doing it quick enough or right enough. We dress them or put their shoes on and we do things for them. What that causes shame and doubt in that toddler who wants to do me, mine, I want to do it myself. Okay? That's the helicopter mom trying to protect their infant, their toddler at this age, okay? They do not have a sense of morality yet. That means right and wrong. They don't get it yet. I mean, later on, closer to age 3, but they don't understand it yet. So they understand id, ego, superego, and they're more of the id. Me, mine, I do it. I don't care about nobody else. Okay, that is a toddler. Now, cognitive development. Now, this is your Piaget. So remember, they are exploring the world up to age 2. All right. And they understand if something, they've seen it, that object permanence, it's going to be there again. They're going to find it. They're putting pieces together to do more. So now they're sucking on that rattle and they're shaking that rattle and they're throwing the rattle. And they're doing all this because if they've learned it just by that one little grasp. Okay. Now, after age 2, they start now doing magical and pretend, using blocks for cars, their arms out, and I'm an airplane, and using a broom for a horsey, and all of those things, okay? That is now using your mind and being magical and making things into what they want it to be. I've put some pictures here that shows you, I think, sensory or motor. How about that time you have them in the high chair and the sippy cup falls on the floor? And all of a sudden, mommy comes running back to get that sippy cup to put it back on the high chair for that baby. What do you think that baby's going to do when they want mommy next time, when mommy's fixing dinner for everybody else or do it, in another room and then she wants mommy? She's going to throw the sippy cup back on the floor because I want mommy. I'm thinking, right? This is thinking. This is cognitive development. So, Erickson, we know that autonomy, me, mine, and we know that the shame and doubt comes from people trying to do things for them, and we need to let them try. We know toddlers are now starting to understand there's boys and girls, and there are differences with it, where they're starting to play with themselves and explore what that genitalia is because they're potty training. They're seeing mommy and daddy, somebody stands up and somebody sits down, and they're starting to pay attention to this stuff now. Separation, we know that it's a little bit easier to do this, but we prefer not to. We want to have mommy and daddy there at all time. We know that sometimes with toddlers, having transitional objects can help, as in bringing their own jammies, their own pillow, their own blankie, what's their favorite pacifier. Maybe it's a stuffy toy. What is it that they need in order to help them be in that environment? Toddlers are now speaking a little bit more. By age 2, it's multi-word sentences. I want milk. I want my doll. I want, cookie, whatever it is. They're going to start talking more and more and more. As I said, they like to be independent. That autonomy, mine, I do it. They want to dress themselves. They want to feed themselves. You need to let them try. If a spoon is upside down and backwards and they're trying to use it, let them use it upside down and backwards. They're exploring what a spoon does. Play. Me, mine. I'm not sharing. This is toddlers. This is parallel play. Okay? Remember, toddlers, they don't share. You can be playing next to me. Don't touch my stuff. This is mine. That's yours. This is my stuff. That's parallel play. Potty training, toilet training. Know that bowels are trained before the bladder, okay? And there is signs of readiness, whereas, they can hold their urine for 2 hours and they're starting to tell you, I need to go, or they're, pointing to them. These are things that you would see. Temper tantrums are something that happens. Know that temper tantrums, avoid them. Ignore them unless it's something that will hurt themselves or other. I think at bedtime, yes, that's the one they don't want to go to bed, right? They always have an excuse. They want another kiss, another glass of water. They have to go to the bathroom again. They want to go hug their brother. I mean, there's just so many things these kids want to do right at bedtime, right? That's part of it. The other part of temper tantrums is, and it's not during bedtime, other times, they say, I've seen the grocery store. These kids just sit on the floor and scream and yell and they want. What should a parent do? They should walk past them as long as they're not hurting themselves or others. That's what is actually recommended. As I said, these kids are no, me, mine. They're negative. I'm going to do it. And we know young kids at the time of stress, anything that's going on, they're going to regress. If they're potty trained, they might have an accident. They might start sucking their thumb again. I mean, these are things that kids do when they're stressed out. Something goes in the mouth. That's how they relieve stress, right? Nutrition, as I said, toddlers are not going to be eating as well as they should. And there is going to be that anorexia because of it. So, another thing about nutrition. What if you have a child who is lactose intolerant and they can't have milk? Well, what does milk provide in nutrition? Calcium and vitamin D. So this might be that child who needs supplements, right? What about a child who just had surgery? And they've got a wound, or they've got this big, deep cut abrasion that needs to be healed. How would you ensure that? Through nutrition? Protein. Protein aids in good wound healing, doesn't it? Also, know that parents have a lot of different alternative medicines as long as they don't interfere with the medical practice that the doctor's doing is fine, as long as they're divulging that. Dental health. We know that at 6 months is the first possible tooth. And that's just toothbrush and water and no toothpaste. As we get older, yes, we'll use a toothpaste, and we're going to encourage, as the baby teeth are all in, flossing. They do say after 6 years old for flossing, only because they don't have the dexterity to do it unless the mother does it for them. Children explore the world in their mouths. So it's not uncommon, and it can happen, lead poisoning. Now, lead poisoning is usually, it's not as much anymore. But if you live in an old building, like let's say New York City, Chicago, big old building in an apartment building, and you have an infant up against a window in a windowsill, and they're little wooden windowsills that have been painted repeatedly, right? Underneath could have lead in one of the paints. What do toddlers do? They chew on windowsills, right? And they get the lead in them. And all of a sudden, you'll see the vomiting, seizures, nausea, all that stuff. This is a child who's now lead poisoning. How do you treat lead poisoning? Well, there's a medication, and there's also something in apheresis, which looks like this machine right here. And we could just pull the lead off so they don't go into lead poisoning. Now, I did a lot of my work in the ER was in the triage area. I love triage. I like the children to come in. I try to figure out what they have so I know where I can place them. So I have to be thinking all the time. One of the big things they come in with is they've chewed or eaten or gotten into something they shouldn't. And these children have ingested something. This is the first thing I do is I'll do the vital signs, take a history, all those things, and I'll call poison control right there in the triage area. And poison control has the most up-to-date information on treating whatever poison. At home, you should tell parents they've ingested something. Number one thing to do, call poison control. Don't start them vomiting. Don't start feeding them milk or bread. No, call poison control. That 30 seconds to call poison control could be the best call that they had. And you know something, poison control will follow up with that child. I'll call them from triage, and in 2 hours, whatever, they'll call the other ER, find out how the kid is, what were the lab results or the x-ray or whatever, and they'll follow up. So it's a great thing. Safety promotion, what's always going to be number one? All age kids, motor vehicles. And then number two, infants, toddlers, preschoolers, and some of the school age car seat restraints, okay? Making sure they're in there properly. Another thing, I've mentioned it before, is drowning, protecting burns, pots on the stove, teaching safety. Falls, making sure they're strapped in. They start turning over by 5 months, so they need to be strapped in if they're on the changing table, or if they're on the bed, they need to be bunkered in so they can't roll right off there. No plastic things on the floor, et cetera, et cetera. As I said, car seats, making sure you have one that's appropriate. Old ones don't work. There's always up-to-date stuff that they institute. So they say any car seats that's above 6 years, 6 to 10 years old, don't use it. Get a new one. In the back seat, rear facing, until they're 2 years old. Now, at 2, you can turn them front facing in the rear seat. They say with toddlers, just again, making sure the shoulder straps are fit smugly and again in the center of the seat. And this is with toddlers. They say age 2 or 30 pounds. My little Christian, who's now 9, he only weighed 24 pounds at 2 years old. He was a little peanut, okay? So we asked the pediatrician, but because he was 2, cognitively, developmentally, he was fine. They said, no, turn it around. It was muscle control that they were looking at. So, preschoolers. Preschoolers are ages 3 to 5. This is where we're starting to get them ready for school. We need to encourage parents to read to them and to get them into some sort of activities that are around other children. We know that their attention span is going to be increasing and they'll be able to sit and to follow a little direction. Growth is still the same, very slow. I mean, toddlers, one of the things that we put them in a hospital, the big thing is putting them on their same routines. Now, preschoolers, they don't have to be as routine as a toddler, okay? Preschoolers handle the stress a little bit better. They're running, they're walking, they're climbing, all of the gross motors. Fine motor, we're using scissors and they're coloring in circles and they're coloring inside the lines and all of these things. Dressing, putting on buttons, they're being able to do this in different ages. Erickson is the people around them, right? So this is a child's sense of initiative, which means these kids like to do things. They like to be helpers, but they don't always do things right. So that's part of the guilt and anxiety that they fear with that sense of initiative they do. As preschoolers now, they're starting to understand morality, right and wrong. They're starting to get it now. But how do they understand it? Reward and punishment. That's what they figure it out. As I said, they're getting ready for school. They should be in other things with children. And now, again, they're still in that pre-operational stage. They're still magical. They're still taking things and using them and making them into things. This is what we call magical thinking. Preschoolers are your true and real magical thinkers. Their language, they're saying words they don't even know what they're talking about. I mean, my little Christian used to like the word teleportation. He was teleporting all over the place, and that was his word at that age. And they all have these really big words they like to use. Doesn't mean they understand them, but they're going to say them because it's a word, it's a big one, they know it. They don't understand 2 o'clock in the afternoon. They understand after lunch, before you go to recess, after you're done with daycare, when you wake up in the morning. They understand time with an event. They don't understand 2 or 5 or 11 o'clock in the morning. They don't get that. Give me, when you get to school, you're going to do this. When you come home, when you wake up, when you go to bed, all of these things. As I said, Kohlberg, right and wrong now. Preschoolers get it. They understand right or wrong. And again, Kohlberg says this is reward and punishment. It's all about morality, rights and wrongs. Now, as preschoolers are starting to know more about their body, they're starting to understand blonde hair, blue eyes, freckles, fat, skinny, tall, short. They're starting to get it. Colors of skins and differences. They're going to know those things and start to see that. One of the big things, and I have probably 1,000 Band-Aids in my house, children at this age think if they are bleeding, that they're going to keep bleeding and they're going to die. And it's like a major emergency, this little piece of blood, and put a Band-Aid on it, everything's all better, isn't it? They don't like intrusive things. What do we do every time we see them if they come to our doctors, or whether a doctor visit or urgent care? We're giving them shots, right? We're sticking things. They don't like those things. Spirituality. Again, this is all about family and what the families taught them, right? That's where they learn it at this time. Another thing about spirituality at this age, they start to think that if they have done something wrong, God's going to punish them. I've seen this with children where they had an appendix that needs to come out, and they think that because they hit their sister the day before, they think that their appendix is busted and they have to go to surgery because they're being punished. I always tell my kids, I don't care the age, 3 or 8 or 10, that if this appendix is something you just didn't need, they didn't do anything wrong to happen. It's just the appendix says, hey, just take me out. I don't like it being here anymore. And you did nothing wrong. The other thing I will tell these children preoperatively is don't worry. I'm going to tell the doctor to put an extra stitch there to keep your insides in so they don't fall out. And they're going to have a Band-Aid on it when you come home. How does that sound? Do you think that's so bizarre? Children, you can watch their shoulders just relax and you could see them, oh, okay, this isn't that bad anymore. So now you've sent that kid to the OR with a better mindset. Sexuality, they understand boys and girls, but they don't understand what sex is or sexuality. They are exploring themselves, they are masturbating. This is just part of being kids. Sometimes you'll see kids together, touching, exploring, playing house, right? What should you do if we see that or teach a parent? Well, we don't want them to feel that sexuality is a bad thing, but we don't want them to feel that they can do these things whenever and whatever they want. So we just say, come on, let's go wash your hands. Let's go get something to eat. Let's get a snack, or let's go watch TV. Let's say the cousins are in the bathroom and they're touching each other or looking at each other. That would be the way to handle it. And that's the way that the book tells us to handle it. Social development, we know separation, anxiety is not as bad anymore, but still there. We still got to be careful with it, especially the younger of them. Stranger danger, they still want to be around parents, but they're more trusting. And one of the things is security is derived from familiar objects. Again, that's the jammies, that's the pillow, that's the binky, that's the blankie, that's the toy, that's whatever makes them feel good. And play therapy is what we're going to use now to have children tell us what's going on without having to use words. Child life is great for that stuff. Language is more and more, like I said, more complex. That's the teleportation that's going to be going on with Christian. We know that ritualism that toddlers need. They need that bath time, bedtime, foods, all the same. Now they feel comfortable. Preschoolers don't need it as much. They need a little of it, but not as much. And they're more willing to not that no, me mind. They're more into sharing at this age. They can dress themselves. They love to please, like I said. And again, still at this age, they only know the family's values and cultures. Play. So, as I said, the toddlers at this point in time, preschoolers at this age and time, these children will share. Toddlers don't share, right? They're parallel play. When we get to preschoolers, now they can play next to each other, all sharing the same toys, but there's no goal. Nobody wins. There's not like a castle built or a house built. No, they're just all playing together, and that's good. We know imitative, imaginative, dramatic play is the one that we do to find out what happened. They come back from, let's say they had a procedure and the child's not acting right. And they said they're afraid this happened. Well, through dramatic play, we can find out what happened and the kid doesn't feel threatened. Sex education, as I said, they're starting to touch themselves. They want to please. They know there's mommies, there's daddies. Don't just start sharing like mommy's pregnant, is having a baby. You don't have to go into all the details. Just find out what the child knows and give them enough information to answer their question. The other thing they say is to use correct anatomic words, especially like this is after the potty training. You know, there's a vagina and there's a penis. Whatever words they said, it should be correct. Another thing, be honest with these preschoolers, they don't forget. When you lie, and it's usually, it's it gonna hurt, and you say no, and it hurts, they're gonna remember you. Like, for instance, if something's still gonna hurt, you need to tell them. You're gonna hear me through this course say it. If it's gonna hurt, tell them it's gonna hurt, but you're gonna do everything possible to make it as little as possible. Okay? They're not gonna hurt that long, and that you'll be there, you'll hold their hand or whatever you work out there. As I said, masturbation, it happens. You know, if something has happened in front of you, you tell the kid, hey, go to your room, that's private. We don't need to watch you there. Again, you're not saying it's something bad. You're saying it needs to be in a certain place. Preschoolers are afraid of the dark, being alone, and big animals. And there must be a ghost in my house. You know what we've told our little Christian as he's been in here, and saying, "Oh, there's a ghost and it's dark over there. Oh, there's a ghost. When you find him, could you come introduce? We'd like to say hello. Did you see a ghost? Oh, nobody was there. Oh, if you see one, could you tell them we want to say hello to them? They're pretty cool people. And now we've made ghosts not that bad. But again, fears are big and strong then. And look at this, objects or people associated with pain. What do? We stick these kids, make them drink things, do things they don't want to do. That's us. We are those people. Speech is a big thing. As I said, that usually after 2 is when we think about it, but absolutely 3 to 5. We absolutely need to identify stuttering, stammering, any of those things, get them into speech therapy. Let's get them caught up before they go to school. Sleep activity, again, they are sleeping usually throughout the night. There are children. My second grandson had night terrors. He would be awake looking, but he wasn't. His eyes were open, but he was asleep. And he'd be doing things at night and screaming and yelling and whatnot. Again, these are normal. It happens. Actually, they put him on melatonin and that helped them. Again, injury prevention. What's number one? Motor vehicles. Why are preschoolers motor vehicles? Well, again, they have to be put in a car seat, a proper car seat. They also, these kids are now mobile. They run, they ride bikes, tricycles, all these things right behind cars, in driveways, and they get run, they get hit. I've actually seen 3 of that happen. Preschoolers ran over by a car in their driveway. One was a next door neighbor, one was an aunt, and one was, I think, a father, mother or father, if I remember. 3 different outcomes. One, nothing happened at all, a miracle. One was pretty ill, and one didn't make it. So again, increase in injury prevention with motor vehicles, especially now that they're mobile around. That's why they're more. Also, these kids now are mobile, they want to move. So again, making sure they have helmets and they have elbow and knee protectors, depending on what equipment they need for whatever they're doing. Families now are getting ready to get these kids ready for school. And kids are now starting to enjoy friends at school, their best friends. And they're, learning more cultures, more things. And we got another person teaching our child. Wow. Okay. It's not just us there anymore. Now it's teachers. Communicable diseases. There's many of them. I think the one that you need to know is chickenpox. What do you see with chickenpox? Now, you're going to say there's an immunization. They don't get it anymore, right? You're wrong. Even with a vaccination, you still can get chickenpox. And as a nurse, if you're working, especially I was in the triage a lot, any child that came in with a fever and a rash, all stages of healing. That's the big thing in chickenpox. Immediately, a mask on me, a mask on them, and I get them into a airflow room as soon as I can. They are contagious until all of the pox are dry and healed. And that's when they can go to school. Conjunctivitis, kids, they're always, their hands and their eyes, they don't wash them proper. They're always going to get it. Again, making sure you clean them from inside out. Remember the ointment. Remember to tell them their eyes are going to be blurry if you put ointment in their eye. Don't let that kid go, oh, I can't see, because they will do that. And those, mouth sores, they can happen all the time. They hurt. Make sure that we give them a proper stuff that we can help them tolerate those sores. And then we go into worms. Preschoolers are now outside. They're in the dirt and they're playing. And if their nails are too long, treatment would be keeping their nails short. If the nails are too long, dirt gets underneath with worm eggs in it. Where do the hands go on all kids? In the mouth. Where do those eggs go? In the body, they hatch. And what happens is they start coming out the rectum and they start itching like crazy at nighttime. Okay. So we need to get a piece of Scotch tape, take a sample, and then they could treat it for it. And it would be the entire family. Usually one person has worms, they all do. Now, earlier you saw me start to mention things about abuse in child, right? Now, children are our responsibility if we think anything that this kid could be abused. And then you're probably thinking, have I ever seen child abuse? Yes. Yes, I have. I have two cases that I'll never forget. One that they starved the child and had him strapped to a bed. And the other one, they smashed the skull of a 3-month-old in the shower surround in a bathtub because they wouldn't stop crying. So, yes, I've seen it. Now, what did I do for each of them? As much as I wanted to scream and yell at the person who had that child with them, I couldn't do that. My responsibility was to remain professional, get the kid the care they needed, and to let the authorities know what my suspicions were and have them investigate, okay? That is your responsibility. So physical abuse, that mush housing that's there. Again, remember with mush housing that the mother or caregiver must be monitored while in the room. Anything they bring in must be looked through. I did that. So parents tell the nurse that their 3-year-old daughter and a male cousin of the same age have been inspecting each other closely as they use the bathroom. Which of the following is the most appropriate response by the nurse? What would you tell that mother? Do we punish them? Do we allow them? Do we want to give them counseling or whatever? You neither condone it or you condemn it. Okay, just say, come on, let's wash your hands. Let's go watch TV. All right, and let's go to our last cahoots. I think we're just about right where we need to be on time. All right, let's get going. I'm going to run through this one a little bit quicker. Toddlers and preschoolers. A multi. Types of play considered to be sense pleasure play. So sense pleasure must be something to do with touch, right? Sense. Which one of them? That's a touch. Playing in the sand, finger painting, mashed potatoes on the high chair, all of that stuff is good. I used to give my kid a cookie and he would eat it and would get smushy and be in his hair and his face and all over the high chair, but it was good. It's what they need. It's cognitive development. What type of play is considered cooperative play? Now we've gone over today parallel play, associative play. We know cooperative play now is your school age, right? And what's the difference with them? There are two or more children playing together with a goal. And this is a board game, it's checkers. Could be building a racetrack, could be building a sandcastle. There's a goal, something ends it. Somebody wins. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning, what? Preschoolers, what do they understand? Morality. So, right or wrong are a consequence for each, or simply reward and punishment. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Preschool age child, ages 3 to 6. They're coming in, they have to have something done. How do you do it? Give them a doll. Show it, let them touch it, feel it, let them see the stuff, and this child's going to be more responsive during that procedure. They like to know. Before performing a physical exam on a toddler, the nurse should do what to encourage cooperation? You have to assess a toddler, ages 1 to 3. Remember, they don't like people. So, first of all, how do you go in? Now, let's start from the very beginning. You walk into a toddler's room, sit down below them, never stand above them. Then you are going to do minimal contact at first and use play on these children. So you've got to do it in steps so the kid will be more receptive to you. A 3-year-old child's having an outpatient procedure. How would you help the child to be less fearful? So again, 3-year-old child, this is old enough. Give them a toy, let them a doll. Let's show them what they're doing. If you have pictures, show them. These are things that get this kid, and they're going to be wanting to do what you need them to do. Before assessing a 4-year-old child, what techniques would you use to approach the child? So, one of the things about older children and understanding more things, know that, if they have a Batman shirt on, or they've got freckles that are cute, or big eyelashes, big blue eyes, or lit up sneakers, let's talk about them. Let make them feel special. And then that kid now, oh, she likes Batman. Oh, I like Batman. That's pretty cool. Now you are less threatening. And that's that reason why. What technique can be used to examine a toddler? Toddler ages 1 to 3. How are you going to be able to examine them and then be more open to it? And again, play. Play, 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 play. I worked how many years in pediatric nursing, and I went to work and I played every day. When assessing a healthy child's lymph nodes, what should you expect? Lymph nodes. Kid's not sick. What would you see? And they should not be there at all. Lymph nodes they produce antigens and antibodies to fight infections. If you have no infection, they shouldn't be able to see them at all. Which Erickson stages of development levels would you use for a toddler? Toddlers. Remember, me, mine, I do. Automatically me, mine. That's how you remember toddlers. Good job. What pain scale would you use on a 3.5-year-old child? You're going to have questions on flack and faces. That's why I absolutely hit this very, very hard on you. 3.5, now it's going to be faces. They can point to a picture. Flack is that 0 to 3 and nonverbal children. They can't accurately point to something to tell you how they hurt. A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does that mean? Automatically me, mine. And what's the shame and doubt? So automatically me, mine. I'm gonna let you gotta let this child do things. It was a hard thing for me. I know I've seen with my husband, he's a very patient Jamaican man who believes in kids should be able to do things for themselves and he shouldn't do it. I have a hard time with that. I want to do everything for them. But I had to learn. And then, of course, with teaching this course, made me understand it more, how I had to let him jump off a couch onto the hammock or onto, the hassock or this or that, even if they might even hurt themselves, as long as it's not going to be that bad, because they have to, or else, again, it's that shame and doubt with it. So, got to let them dress. You got to let them try things. That's how they learn. A 2-year-old is playing with mud and dirt. What type of play is that? And it is sense pleasure. Very good. The parent of an 18-month-old boy says he says no to everything and he has rapid mood swings. Is that what 18 months old do? What did I tell you about toddlers? Me, mine. No. Absolutely a toddler. What is descriptive of a preschooler's understanding of time? It's 2 o'clock in the afternoon. We're going to Disney. Do they know what that means? They only understand time with events. I mean, even my Christian, it's about 7 or 8 by the time that he understood what the time 4 or 5 o'clock, they could read the clock and know what was going on with it. In fact, he got a clock for his birthday, a little G-Shock for his watch. Oh, he is so happy. He's 9 now. What age would most children could understand under, on top of, beside, and back, over, under, around, next to, all of those things? When should they? And again, if you have children, please don't tell me what your children would say. It's the book. Because I would say 3 years old for my kids, but the book is 4 years old. In terms of language and cognitive development, a 4-year-old child would be expected what? Okay, 4-year-old children can follow simple commands. Take your shoes and go put them in your closet. Take your dirty clothes, put them in the laundry. Take your dishes, put them in the sink. Follow simple commands, and they're the magical people. What pain scale would you use to assess the pain of a toddler? Toddler, ages 1 to 3. That is the flack scale. This does not surprise me. You guys got to remember, what is flack? What is faces? Remember, faces, is you can use it for ages early as age 3, and you could use it forever if you wanted to. A multi. What are the cognitive characteristics of a child in the pre-operational stage? Remember, initially it's the sensorial-motor for that first 2 years where they're looking and exploring. What do they do after that exploration? They take blocks and they take brooms and they take all different things and they become imaginative, okay? Still, these children, they don't understand other people yet. They just don't. But again, this is where they have the blocks, which are cars, which is the broom, which is a horse. These are things imaginative, magical, and using those objects. A 2-year-old has difficulty in activity, sensory sensitivity, and only speaks one-word responses. Now, we know a 2-year-old should have more than one word, and they should, be able to handle people and sounds and noises around them. When you can't, there's a problem. And you're always going to have some sort of checklist to look at. And this is just to tell you that there are different checklists. This is possibly an autism type child. One word, sensory problems, it could be it. Just know that there are different checklists that we can use, depends on what your hospital uses. What fine motor skills is expected of a 4-year-old? Fine motor, remember that's F for fingers. So skipping is gross motor, that's movement. Walking, again, is gross motor. The only fine motors are here is tying a shoelace, buttoning a shirt with my hands, my fingers. A multi. What gross motor skills should a 4-year-old be able to do? I put these 2 questions in here because I want you to be able to look at it and say, oh, that's fine motor. Oh, that's gross motor. I know the differences. So walking, hopping, jumping are good. Tying a shoelace is fine motor skills. You do it with your fingers. A multi. Which would alert the nurse to hold the digoxin on a toddler she's caring for? Remember I told you need to know different heart rates and things for children because you might be able to give some meds? Well, what else do you know about digoxin? It's the same thing as adults, and that is heart rate. It needs to be at a certain level. A toddler, I would say 100 would be the lowest I'd see in a heart rate, or 90 at the lowest. Dig level you're looking at, and you're looking at your potassium. Pulses have nothing to do with digoxin. How can you prevent otitis media in children? Biggest thing with otitis media is smoke. So anybody who wants to smoke, go smoke outside, not around my kids. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? I can't tell you how many times I get these children into the ER and they need to take something, a medicine or steroid, something, and they don't want it. And the parents can't make them take it. And it's a very difficult thing. So what they say is straightforward. Would you like a pill or would you like a liquid? Do you want it in a cup? Do you want it in a spoon? That's what I want to hear. Do you want a popsicle when you're done with it or you want juice after it? That's what we say by straightforward. Which intervention helps a hospitalized toddler feel a sense of control? And remember, ages 1 to 3, they don't do well in a hospital. They don't do well on vacations, do they either? They tend to be, they don't sleep well, they don't nap, they're cranky. It's because they want the same routines for feeding and bedtime. Vacation messes it up, so does a hospital. And it's just part of toddlers. A multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? There was one HESI about 3 years ago that had 4 acid-based questions on it. So you're going to get acid-based questions with me, and I want you to understand them. So when you have diarrhea, what happens? You have all of your digestive enzymes in your GI tract, and you lose them through diarrhea. They are alkaline. So you're losing alkaline like crazy. What is left? Acidosis, okay? Of course, potassium can be low with any time you're losing. When you vomit, what are you vomiting? I am vomiting acid. What is left? Alkalosis. So metabolic alkalosis would be for vomiting. That's how you remember both of those. And last question, normal language skills for a 3-year-old child. 3 years old. We're just turning preschool. They should be speaking like 4 words in a sentence. I want to go to Nana's, type things. This sounds like my grandson. It's Friday. He's asking right now. Karina, good job. You did good on both of them. Aaron, good job, Aaron. And number 1 is doop, 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 doop. Another AG. Good job, AG. And a jazz and an M&M. All right, so this is the end of your class for today. Know that next week there is no quiz. All right, so if you're thinking about that, you don't have to worry about it. Remember, next week we are going to be starting our reviews. I'm doing mine, I think, on Tuesday at 3, if I'm not mistaken. I put it out there for you. I think some of them I might have to change. I believe Professor Gaux is going to be doing a Monday, 10 a.m., if you all want to go. Know that every review is recorded. Yes, they're all going to be posted in one announcement. It'll say recordings, exam review recordings. And as I get them, I'll put it in the same announcements. You don't need 6 or 7 places to go looking for it. Also know my YouTube channel has previous ones there if you want to look. Again, I've redone the PowerPoint again. It's me that I did it, and I'll be reviewing that for your exam. Guys, it's been a great time. Have a nice weekend, okay?
Thank you,
and I'll see you all
Professor.
next week. Take care.